How's it going, everybody? My name is Aiden Turner, and this is my presentation on needle exchange programs. So, needle exchange programs, or NEPs, or syringe service programs, what are they? Well, they're community-based harm reduction initiatives in response to growing overdose deaths from street drugs. They're aimed at combating the transmission of bloodborne illnesses, provides access to sterile needs, and facilitates safe disposal of used needles, and provides a safe space for people using the program and connects them with any additional resources or services they might not know of otherwise. A few of those additional resources include referrals to treatment programs like for substance use, social health, mental health, or other services, vaccinations, or screenings for STDs. The intended impact. With the first needle exchange policy and program spawning in America in 1988, the service primarily intended to prevent the spread of HIV, viral hepatitis, and life-threatening infections such as endocarditis. Used syringes would be safely disposed of by professionals, leading to cleaner and safer spaces for the public. Ideally, patients coming in would also gain access to education and resources about drug use, overdose prevention, and other supplemental information to help fight addictions that they would not receive on the street. The actual impact of needle exchange programs has reduced infections. NEPs have lessened the spread of viral bacterial infections, fungal infections, skin infections, and a magnitude of other infections, all from simply providing people with access to sterile injection equipment and safely disposing of non-sterile needles. They have also reduced overdose mortality rates. Through healthcare provided at NEP sites, problems in patients can be noticed earlier and treated sooner for a population of people commonly looked down upon by the public, including in hospitals. A study in Vancouver, Canada found a 26% reduction rate in overdose deaths surrounding a syringe service site compared to the rest of the city. A separate study in Barcelona, Spain found a 50% reduction rate in overdose deaths between 1991 to 2008 when implementing similar services in the city. The follow-up impact of needle exchange programs. Not only can needle exchange programs continue to reduce the spread of bloodborne illnesses and lessen overdose death rates, but it can be cost-effective too. Substance use-related infections cost U.S. hospitals $700 million annually, and the estimated lifetime cost of living with HIV is about $500,000 per person. But NEPs reduce the likelihood of acquiring HIV and links people to the treatment necessary to stop using drugs altogether. Hence, it also reduces drug use. People who use needle exchange programs are more likely to begin treatment for substance abuse disorder than those who do not. A study in Seattle, Washington found that program users were 5 times as likely to enter drug rehabilitation treatment opposed to those who did not. And it creates more awareness. The effectiveness of needle exchange programs have led to an increase in studies on the topic within the realm of data and analysis. As such, more and more studies are beginning to focus on the impacts and outcomes of these programs, which leads to more public awareness, as well as data-driven perceptions on the ability of these policies and programs more than stigmatized outlooks. A different perspective. The most common belief in opposition of needle exchange programs are that these programs contradict the war on drugs and incentivizes further drug abuse rather than reduction. Some believe that addiction does not exist, or if it does, the effects and outcomes of it are not nearly as severe as people make them out to be. These beliefs stem from legislators and constituents alike who argue that taxpayers should not have to fund services for those who make unsafe decisions. Essentially, if it's created or caused by them, it's on them. The Code of Ethics. First, service. When analyzing needle exchange programs in relation to the core values of social work, these two principles align most with the NASW Code of Ethics. It is a fundamental and ethical principle of policies and programs to help people in need and address social problems. Considering the continued increase in opiate overdose deaths even today, with there being a 37% increase in the United States between 2020 and 2021, people addicted to drugs are quite clearly people in need of help. Not only in the prevention of spreading illnesses, but in lessening the number of overdose deaths overall, providing individuals with the resources necessary to combat addiction and lead a better life, and disproving the social stigmas around drug users through effective programs producing results. Dignity and worth of a person. Going above self-interest is not enough. Having a social responsibility to be mindful of every individual and their own unique experiences is a core part of the NASW Code of Ethics, as well as seeking to enhance clients' abilities to desire and create a change that addresses their own needs. Needle exchange programs do just that, directly seeking to resolve conflicts between both individual and societal interests in a way that is consistent with the values, ethical principles, and standards of social work as a profession. Summary. Although federal support is still lacking, communities on the state and local levels are leading efforts to implement harm reduction strategies on the ground, ultimately for both the betterment of individuals in need and society as a whole. While popular beliefs in America may be detrimental to the individuals in need, as well as the policies and programs in place to aid them, scientific data continues to support the impacts and outcomes of needle exchange programs within communities across the globe. Not only have these programs successfully achieved their intended impacts, but they have also created new perceptions and follow-up impacts for policies and programs surrounding the need for aid to those facing severe drug use, and addiction. The discussion question is, through funding and public awareness, should legislators and the federal government support programs aimed at lessening the severe outcomes of drug use, such as needle exchange programs, or should new policies and programs be put in place to combat individual use of opiates altogether? What might this look like, and what would it be? Residual, preventive, which is institutional, or both? Thanks. That was my presentation. Hope you enjoy.